Okay, thanks for tuning in. Let's go through this. I'll be breaking down my evidence-based practice assignment for the frozen shoulder case in class. My PICO question was the efficacy of shoulder scapular exercises and standard of care versus the standard of care for improved shoulder function and pain for an adult female patient with adhesive capsulitis. For my literature search, I searched for adhesive capsulitis or thawing adhesive capsulitis or frozen shoulder and physical therapy or manual therapy, an adult female. I limited for randomized controlled trials and free full text articles, which yielded 403 search results. The 9th article was the one that I chose, titled Dynamic Scapular Recognition Exercises to Improve Scapular Upward Rotation and Shoulder Pain and Disability in Patients with Adhesive Capsulitis, a randomized controlled trial. Strengths of this article are primary inclusion of less than 100 degrees range of motion, normally distribution at baseline testings between all participants and between groups, double blinding being present, having a different PT perform the initial evaluation versus the PT who performed the reassessment, participants being randomly divided into groups, and a consistent measurement of the range of motion and SPADI scores intermittently throughout the study. The potential bias of this article was that it was only done at one clinical site, and it could be reasoned that the extra proprioceptive feedback for the dynamic movement group could have been offered to the patient for a control as well, although not at the same end range of motion as was performed. For the application, for my assigned patient, I can utilize this article by including external proprioceptive feedback in combination with the other treatments that I was performing of active range of motion, PNF, and scapular strengthening, as those treatments seem to be beneficial and improved her symptoms and presentation during the role play in class. Here is the reference to the article that I used. Thanks for tuning in.